After inheriting a prison system on the brink of collapse, we had no choice but to introduce emergency measures, releasing some prisoners a few weeks or months early. Unlike the End of Custody Supervised Licence Scheme, ECSL, introduced by the last government, SDS 40 had an implementation period that allowed prison and probation staff to properly prepare for release, while helped us to reduce the risk of reoffending. Planning for release includes temporary accommodation for those at risk of homelessness, access to employment, and continuity of mental health and substance misuse provision. Those released under SDS 40 will also be subject to strict licence conditions. If offenders break these conditions or commit further crimes, they will be punished and could be immediately recalled to prison.
Sorry. I thank the noble Lord the Minister for his answer, and I welcome him to question time. My Lords, more than 3,000 prisoners serving terms of more than 4 years for serious offences are due to be released this week, starting from tomorrow. Martin Jones, the Chief Probation Officer, told the BBC it was a certainty that around a third would reoffend. My question: of those released in the first batch in September, can the noble Lord the Minister tell the House how many have been recalled to date in connection with a subsequent suspected offence of violence?
We don't yet have all of the exact figures, but when they are verified, we will be publishing them in the normal way. But the noble Lord is correct that we've inherited a system that is very difficult, and there are far too many people being recalled. For the second SDS 40 stage, we're as ready as we can be. Victim contact data is very reassuring, but as in a lot of areas that we're dealing with so far as full prisons, it is not as straightforward as I'd like.
Given the number of prisoners who become dependent on drugs before, during or after leaving prison, what steps will the government take to ensure that better treatment and psychological treatment in particular is available to them, whether they're released early or at the normal time?
I thank the noble Lord for the question. 49% of prisoners have drug misuse problems, and it is clear that those who go into prison, sometimes drug-free, come out addicted to drugs too. So from drug-free wings and other NHS and support services that are absolutely vital, they work, but they also need to work when people leave prison too. But with the SDS 40, we've had more time to plan these releases, and 8 weeks, whilst it's not perfect, is far better than the previous early release scheme. So we are confident that these links are there and are working. But one of the things that I am confident of, having been around prisons for so long, is when you have prisons that are so full, it's difficult to make everything work as well as it should do.
My lords.
No. Does the Minister agree with me that under the last government we saw the actually decimating of the probation services, putting the public at risk? How long does he think the Minister will take to actually repair the damage that's done by the last government?
The noble Lord is correct that probation is under a lot of pressure at the moment, and our probation colleagues do an amazing job in these difficult situations. And I've been fortunate to spend a lot of time since I've taken on this role visiting probation staff around the country. And although we're recruiting 1,000 extra probation staff by March next year, and that is on track and going well, it does take time to train people and for them to gain the experience, because a lot of their role is about relationship building and understanding the challenges that offenders have.
My Lords, one of the ways in which the prison population can be reduced, of course, is to deal with prisoners on remand, of whom there are 1 in every 5 of every prisoner at the moment. They don't have any access to a meaningful activity, and of course what we need to do is to move along the process by which they have their cases heard. Could the noble Lord the Minister tell the House what steps are being taken in order to reduce the remand population, and when we're likely to see that reduction in effect taking place?
I'm afraid I wouldn't want to put a date on when things are going to change, but what I can assure him is that the high remand population of 17,000 is far too high. And he is right in that a number of prisoners who are on remand do not engage as well as they should do in all of the opportunities they have to turn their lives around, for example, education and purposeful activity. But changing the magistrate's sentencing powers to 12 months will free up Crown Court time to reduce the backlog, and this will reduce time spent on remand.
My Lords. My Lords. My Lords. My Lords.
I'll get them both in.
Keep going.
Okay, go off then.
My Lords, what help is being offered to families who experience difficulties when a prisoner is returning home earlier than expected? And is the Minister familiar with the prison-based family hub Spurgeons are running in HMP Winchester? This connects families with the full range of support local to their homes and works with them in full respect and recognition that they are often the most effective frontline rehabilitation assets in released and serving prisoners' lives.
I thank the Noble Lord Farmer for this question and also for the incredible work that he has done over many years in this area. One of the benefits of STS 40 is that it provides an opportunity to plan for the release compared to the previous ECSL scheme. Strengthening family ties remains a focus of the Ministry of Justice and HMPPS, and we're working with our partners to deliver a service that helps families and loved ones build and maintain positive relationships, including those released earlier than they previously would have been. For example, our family support workers help to re-establish family ties where appropriate and critically help to facilitate visits from prisoners' children. I'm hugely grateful for the work of Spurgeons and of the many charities and volunteers whose dedication helps prison leavers resettle into society, supporting them and their families at such critical times. The hub they run at HMP Winchester is an excellent example of this.
My Lords, declaring my interest in the register. My Lords, declaring my interest in the register. Would the Minister agree with me that to help address reoffending, wherever possible, the prisoner should have access to the excellent NHS Reconnect service in advance of release, and particularly tries to address the issue of continuity of care for people with mental health and related conditions as they return from prison back into the community?
I thank my noble friend for that question, and he's completely right that it's so important that the continuation of care in NHS Connect. In fact, I don't know whether you were looking in my office about 2 hours ago, but we were having a meeting on the exact subject. I was fortunate to spend 2 days working in HMP Preston, following the officers around, and what was very clear to me is there were a lot of men in that prison who were very ill, and what they needed was the care of our fantastic NHS colleagues.
My Lords, the Minister mentions that the probation service is indeed...
My Lords, would the Noble Lord the Minister agree that the probation service needs all the help that it can get, particularly at this time, to focus entirely upon preventing further criminal acts by people who have been discharged from prison? Somehow the probation service seems to have lost some of its sharp focus on that, and preventing recidivism should be their key task.
When 80% of offending is reoffending, there's something clearly not working. And I'd like to give the Noble Lord just one example. When I was opening a probation delivery unit in Preston, there was a man standing outside with a sleeping bag around his neck. And what was very clear, that if he was going to spend the night on a park bench, he was probably going to reoffend straight away. So there is an awful lot of work that we need to do, but for me, the focus needs to be on addressing people's mental health, their addiction, accommodation, and employment needs.
My Lords, the Minister has mentioned that the probation service is indeed on its needs. And
The highest cohort of reoffending group is the 15 to 17-year-olds, with temporary accommodation being the main barrier for supporting these young people. So may I ask the Noble Lord the Minister What targeted interventions will government consider to alleviate this barrier for this group of very young people?
Accommodation is a big driver in cutting reoffending, and having been brought up when I was younger in a home full of foster children, I'm well aware of the problems of accommodation. It's not just decent accommodation, it needs to be accommodation where their needs are understood and they have the opportunity to receive care and kindness from experts who understand the challenging difficulties that these young people have, especially around their issues around attachment and mental health.